Welcome to this talk on anti-aging, reverse aging. The first question I have for Dr. Jolly is, what is aging biologically?
See, in biologically, there are so many mechanisms playing in aging part. Actually, the one baby is formed from a half egg or 23 chromosomes in the sperm and 23 chromosomes in the egg, and it is fusing together and start growing in the uterus. And it is programmed for say 100 years or 120 years actually. And what happens is, if the baby is getting in from the inside itself, if it is getting correct nutrition, and if it is not exposed to it, minimize. There may be always there is toxins can be there, but if the toxin exposure is minimum during the intrauterine growth and after it is grown, and in the different phases of growth, the growth is actually the development. That's full grown person is developed around 20-25 years. Between 20 to 30 years we can take, and middle we can take is by 25 years one person's growth is almost completed. And from that to one single cell to it has grown by division of the cells and reaching around 50 to 70 trillion cells actually. Then it is how the activities, how the nutritional status and the toxin levels it is exposed and the activities which decide how the health is maintained. And if the person is able to give get correct nutrition, less toxins, and a moderate, not exercise also should not be too much or too little. And in everything is in moderation, the person will be get an expected as the lifespan of maybe 100 or 120 years of lifespan. And that also depends on how much diseases he is having also. If there is any problem in this nutrition or this toxin exposure or the activities, the person can get different sort of diseases, especially metabolic diseases. And also toxins can be a bacteria or virus, biological agents also. If the such a toxic exposure is too much, can go for leads to death or a compromised health, and it depends on what the basically it is all the biological health, and this depends on the genetic material and the surroundings or the nutrition and the toxins and the activity level. It depends.
How much does diet influence aging? Because generally everyone has a feeling that certain foods will make you age faster, while certain foods will keep you younger longer. What is the truth?
See, why we are eating actually? We are eating to get our nutrition. That is, nutrition is for two purposes. One is for meeting the energy needs. Second is to building up our body, or once you are 25 or your building process is over, to maintain it. So body is changing every minute or even every seconds. There are so many cells new cells are coming, so many are dying, and the immune system is taking away the aged ones, senile ones, which is not properly functioning, or the diseased one. There is always body is interacting with the bacteria and viruses and all will be there, or even a toxin, or even an allergy. If you are sneezing, that means there is an allergen in your nose. And the nose, this allergen is attaching one of the cell in your nose, and it is stimulating, that is making this sneezing reflex itself. So the few cells are damaged there. Immediately the immune system will take it away, and that is the This protective mechanism is actually, or defense mechanism is inflammation. That is actually creating the sneezing. And anti-inflammation, that is the rebuilding process. For even if a war comes, there is a defense and destruction will be there. And equally, there should be a mechanism to rebuild also. If a bridge is gone, it has to be rebuilt. So the same way inside our body is the rebuilding process also is taking place. So the rebuilding needs it's an anti-inflammatory process. That is the healing process. That also need nutrition. So if these activities are in a balance, you can have health. So for that, the nutrition, the food, the diet is so important, because we are eating to have this nutrient. So there are 57 nutrients, including oxygen and water. 57 nutrition is the scientific world is accepting it. 57 nutrition is needed for human body. That is, some are essential and some are, even if it is not there, if the other things are there, we can build it up. So if these nutrients are in the correct proportion for the body building and which is needed for the calorie, the energy production, then that is the purpose of a diet actually. If it is excess, anything in excess is considered as a toxic, even our food or nutrient. For the simple example is, for a diabetic patient, diabetes means excess glucose. Excess glucose means you're eating too much of carbohydrate. Correctly, if the patient, if the person is diabetic, their lifespan is accelerated aging, because this excess glucose will damage the blood vessels and it will damage all the systems. The blood vessels are damaging, it will affect the all the organs, because everyone needs blood circulation, everyone wants nutrition. This nutrition is coming through the blood only, and all the cells is having waste material. It has to be removed through the blood also. So if this the most important disease is diabetes and the dyslipidemia, excess cholesterol or excess fat in the blood or excess glucose in the blood, both is actually damaging. Actually, scientifically, the most important and the tried and the proved mechanism of anti-aging or reverse aging and all is low calorie diet. Low calorie means not just a low calorie. If you are not taking much calorie, that all will not give that simply low. It's not calorie. The low calorie diet with all the bodybuilding and nourishments, otherwise nutrients. But the calorie is mainly comes from the fat, especially the saturated fat or other fat which is excess. Now, the other fats are generally considered the body building, that is needed for the body building, and protein is needed for the body building, and also vitamins and minerals is the needed for the this as an enzymatic reaction and so many sub activities to stimulate or to support this bodybuilding activity. Vitamins and minerals is needed. 14 vitamins and 14 minerals is needed for our body, and also dietary fiber, that is also needed for this. Actually, we are not existing by ourselves alone. Actually, there are so many microbes. We are interacting with the microbes also. There are so many microbes inside our intestine and also the skin, and everywhere there are microbes also. They also need nutrition. And especially this intestinal microbes, they're having a major role in our immunity and health and all. They need this fiber to for their habitat actually. So the dietary fiber also important. So all this diet is the most one of the most important factor for the health and even aging, anti-aging and everything.
Actually, one of the questions that is important to this aging is basically, the amount of food that you consume after, say, peaking of at 25 years of age, uh, continues to increase. While according to science, after 25 years of age, with more sedentary habits and all that, we are supposed to reduce on the quantum of foods, especially calories. But why does this not happen? Why are not human beings able to actually reduce on the calorie consumption corresponding to the increase of sedentary habits as they age?
See, we are reaching around our peak of muscle and bone development by around 25, if you take. So, till that, we are in the college, college, and all. There will be some physical activities also there. So, we'll be keeping fit. But after 25, generally, either you go for higher studies or for a job, then or starting your family, women start pregnancy, childbearing, and also even the working also. So the physical activity that is reducing, whatever is, especially with our modern life, everything is mechanized. Not only everything is mechanized, there is easy food availability is there. And also you will be while you are a student, you will not be having plenty of money, but if or limitation will be there for the money also. So you will be having other money is limited, and also, or otherwise you have to get it from the parents, so you will be having some difficulty in getting the money also previously. But nowadays it is also changed a lot. The children are also getting more pocket money, the junk food is there. So easy money, and the food is itself is made in such a way that deceiving your taste actually. Previously, when you're using natural things, you won't feel like eating too much of things because you will feel that is enough. But what happened now is actually many things is added to increase the taste. So your systems, your brain is actually deceived, and there is not much nutrition, but the taste is there. So you have a tendency to eat more of such things. Those things are actually calorie only. If you take many of this so-called tasty food, it will be made mainly more excess carbohydrate will be there, excess fat will be there, and especially this tasty and this baked and pastry items and all, it will be hydrogenated fat. Actually, our body doesn't know how to handle the hydrogenated fat. It's not a natural thing. So, if it is entering in our body, then it will be dumped into the adipose tissue, that is the fat cells, and it is kept there. If the other things are there, the body will be always easily using that. So this sort of unnatural hydrogenated fat and all will be dumped into the deposits. This hydrogenated fat is actually, what is fat? It's only hydrocarbons. It's basically hydrogen and carbon in a most compactable form as an energy. So the hydrogen carbon content in our body is building up. So our body has a proportion. See, there is 65% oxygen, around 70% of water, or 68% water, and everything has a proportion. This proportion is drastically changing. So it will accelerate aging process, and so the accelerated aging will be there, and it will affect the metabolism. So you will get metabolic disorders like hypertension, diabetes, dyslipidemia, and things like that. and your immune system will be derailed. You get allergy, autoimmune disease, cancer. So, and you will be prone for the infections. So that is actually the basic composition. Everything is depends on the food and action, the exercise, actually the activities and the toxin level. So when it is there is a derailment, the system is reacting like that.
See, one of the changes that a person undergoes when he or she ages is actually in their hormone levels. So we see that hormone replacement can keep people younger than they actually are. That is what we hear. How true is that?
See, definitely the hormones has an important role in our growth and keeping us young, and also there is a deterioration of some of the hormones when you age also. So when we take this children, actually our aging starts from when you are in the first at the zygote stage itself. When you're a child, when you're growing up, your growth hormone level will be high. Growth hormone is one of the important hormone which is there for the supporting the growth. If the growth hormone is low, the child can be retarded or the height won't be there. But for that, if the growth hormone is low at the teenage time, if it is low, if you supplement it, definitely the height, you can reach the height and all. That is all well and good. And when we come after that, the teenage, after the youth, there is sex hormones as a important playing the maintaining the youthfulness. In 19 actually that we are started using in 1960s and all, the estrogen was there, and the women are given postmenopausal hormone replacement therapy. So the hot flashes, the menopausal symptoms are gone, and everyone was very happy for some time. So very high doses of estrogens were using, and after few years of use, not few years, 20 or 30 years of use, in 1960s it started, and maybe in 70, I think it is 70s and 80s or early 90s, we are started understanding the problem, breast cancer, uterine cancer. So if a hormone is given, it's a reproductive hormone. Overexposure of the reproductive hormone can lead to cancers related to that organ. That is, then after that, actually, we have almost initially reduced dose. Now, only for the not as an anti-aging treatment. I don't think anyone is using that because we don't want cancer. To have a cancer is much more devastating than the aging, actually. So this breast cancer and uterine cancer, if you're got it, it's then the cancer medicines and all the toxins, and you can understand. So now only for the hot flashes for a short time use, that itself is a very low dose treatment only given. But previously it was not like that. It's very high dose were used. So that is the end of the hormone for the women. And also it is given for the male hormones also. That's testosterone and all was very much used for the bodybuilding. And now also I don't know how much it is. There are anabolic steroids and all is used. That is how actually working in way it is the testosterone level, but it has also so many side effects. Especially when it is long-term use, again it is prostate cancer, male-oriented cancer, prostate cancer is the one of the thing. And other systems also can be got damaged. We don't, but I don't think it is not nowadays only for the youngsters for the bodybuilding and all it is used. Definitely it also has side effects. It is very well documented over that. Now some especially in the Western world, US and all, there are anti-aging clinics or something, anti-aging association, and so things are there. And they are, according to I don't think in India it is such things are using. Basically, the growth hormones also there is a role, but we don't know that. But how much it will, whether it can, if long term use, it can produce cancer and all. But it can definitely give short term benefits. Definitely, theoretically, can give short term benefits and keeping you some maintenance of the things can happen. But the problem with this growth hormone is it can be usually injectable format it is available, and it is costly also, daily injection, and so it is not that easy. So the misuse is not that rampant actually, this thing. And the only thing, if it is for a long time and we use, then only we will be going to, or 20 years, 30 years continuous use only, we can see what are the side effects, what is going to happen. So I don't think there is much role for the growth hormone or any other hormones. Only the hormones can be used as a replacement therapy, not as for anything else. Actually, one of the most misused hormone is actually insulin. Actually, so we are actually only that for the type 1 diabetes, only the insulin is deficient. The type 1 diabetes definitely need insulin, but type 2 diabetes and which doesn't have any insulin deficiency, it is only insulin resistance. The problem is excess fat in the body or nutritional imbalance is the problem. For that is we are using the insulin very commonly. So insulin or any hormones is not, I don't think excess hormones will be definitely harmful. Only the hormone is useful only for, if it is a deficiency, definitely there is, it will help you anti-aging and help you maintaining your health. Otherwise, it is not a useful thing.
When we are talking of aging, it is everyone's desire to, if possible, grow younger. At the same time, generally we are seeing people in either their 40s or 50s or 60s or higher ages, they will be always having associated chronic disorders like high cholesterol, high triglyceride, or high glucose levels, or having kidney function problems and liver function problems. And overall, in general, we see the obesity problem rising. That is basically overweight and obese and all that. Now, according to what we hear, always the general scientific approach is that if you have cardiovascular problems, or if you have high triglyceride, high cholesterol, it's like you're losing 5 years of your life. If you are having obesity, you are losing another few years. If you have a kidney associated disorder, another few years. Liver associated disorder, another few years. Like that, when they calculate, they say that you will lose this many years if you are having such and such a chronic disorder and all that. At the same time, now this latest research and all that shows that certain gene therapy and certain other very scientifically advanced sort of therapies, either in the current or in the future, that seem to be helpful to increase longevity. So the general feeling in the population is that these therapies can help us live longer. As a doctor, what do you see in that? With all these chronic disorders and other issues growing, can those people also hope to live longer with these new technologies, or or is it wiser for them to think about doing something on their chronic disorders?
See, all the increasing diseases are of lifestyle origin. Usually it starts with obesity or diabetes, hypertension, dyslipidemia, cholesterol, triglyceride are increasing. What is diabetes? When it come to diabetes, it is actually excess glucose in your body. You are eating more carbohydrate which your body can manage. If it is a type 1 diabetes, there is definitely a high the hormone deficiency is there. Your pancreas is knocked out because of an autoimmune disease. If it is knocked out, if you understand before it is totally knocked out, you may be able to control the process of autoimmune process which is destroying the pancreas. But don't expect it is to be done by a medicine. You had to improve your immune system. Immune system is inside you. You can give what is necessary for the immune system, and then you can come out of a autoimmune disease or allergy. You had to remove the allergen, and you try to give the bodybuilding materials or the nutrition. Bodybuilding material for the human body, the bodybuilding material is the nutrition. And the nutrients for the bodybuilding in the correct proportion, like protein and also the fat, omega 3, 6 and 9. There are 4 fats are there, out of which omega 3, 6 and 9 is the mostly is needed for the bodybuilding, and also the protein. And to assist that the bodybuilding process, you need vitamins and minerals in the correct proportion. And this health and or the immune system is dependent on or controlled by 2 essential fat actually. That is omega 3 and omega 6, 2 essential fat. That is actually controlling your whole immune system. Immune system means everything. And not only even the growth and development, everything is controlled by, the final control is in this omega 3 and 6. The balance of omega 3 and 6 also is very important. Omega 6 is inflammatory. That is actually looking after the defense part of the immune system. And the omega 3 is looking after the rebuilding of the immune system. In the modern diet, the major problem is the omega 6 fat is so high because you are using more seeds, this oil seeds and nuts and all. It contains very high percentage of this fat. Basically, most of the cooking oils is very high in omega 6 and very low in omega 3. So the proportion is changed. So the rebuilding or the anti-inflammatory activity or the repair or healing activity is reduced, and also there will be some deficiencies in the vitamins and minerals also, or even the other omega 3, 6 and 9, and the fat protein is low, then the body building will not take place properly, but the inflammation is very high. So ideally for the body to function in a correct way, some certain proportions are needed for especially this omega 3, 6 balance should be around 1:1. And all the other nutrition, vitamin A, B, all these 14 vitamins and 14 minerals also in the correct proportion. Then only the body, the anti-inflammation or the healing process can take place. When this is in balance, if there is a bacteria or a virus is coming, the defense mechanisms will remove that, and the affected cells also. When a toxin or the biological agent like a virus or bacteria is infecting a cell, that cell itself is removed, and for the healing purpose, this cell has to be rebuilt. A new cell is formed. When that is always happens in every second. Millions of cells are born and destroyed. Even if there is a fault in the building of the cell, there is a genetic damage is there. Actually, cancer is an accumulated genetic damage. And this accumulation of genetic damage happens because of the toxin or deficiency of a vitamin or minerals, an essential nutrient deficiency. So this accumulation of genetic damage will be there, and it is accumulated in the when it is out of control, the cancer comes. So if the system is in balance, there will this defense system and the rebuilding system is going in a fine balanced way, you will be healthy. And even the aging process is slowed down. So when your body has a limited number of cells, especially when the one cell, that is base cell, can divide only around 50 to 70 times. And after that, a new cell has to, stem cells. There are stem cells in our body. So if you are becoming sick, even like with diabetes, hypertension, other or even infections and all, more and more stem cells are used. So finally, at old age, what is happening is the stem cells are reduced, and there is no rebuilding is taking place, and the immune system is down. And even the red blood cells, even the bone marrow cells will be reduced, or even in a patient with kidney failure, kidney rebuilding is not possible. That is, then you are getting old, or your systems are finally not functioning, and you reach the end stage actually.
Actually, this when you're talking of aging, reverse aging and all, usually the most common approach is to have cosmetic corrections like dyeing the hair or using cosmetics on the skin, face, neck, hands, etc. So, what is it that you see from a medical point of view regarding the application of these products?
See, you are using dye for hair, hiding the hair. It's only hiding, not anti-aging. It is all these cosmetic applications, either it is hair dye or application on the face. It's all actually mainly for the hiding, not for anti-aging. Even the cosmetic procedures, like applying Botox injections on the wrinkles, or this lifting some injection, or implanting and lifting the face. It's all actually it's help only hiding. Actually, it also final point of view, it is actually accelerating aging, because you are introducing it. It's no what you are introducing into body is not a nutrient. It is a toxin actually. Botox is a toxin. We all know that. And also anything which is implanted, even plastic surgery, some augmentation surgeries are done. There may be implants also. There are all foreign bodies. When anything foreign, it is not body or our immune system take it as a toxin, or it has to be expelled. So they start reacting to that. Even we are implanting to release a block. We are implanting a stent. So, but that's a steel wire which is actually considered our body or the immune system will take it as a toxin only, or it has to be removed. That is anything which is not of your part of your body, your genetics, then the immune system will start to remove that. So we are actually, after putting a stent, what we do to reduce the immune reaction, especially which is a flowing blood, the clot can be, that is the first mechanism of immune system to remove that part. The clot can be formed. So what we are doing after putting this thing, we give the blood thinners, not to make any clot. So that is what we are doing, or when your transplantation is done, if you are putting in another person's kidney in your body, then first thing you have to do is you have to knock out your immune system for not removing that or attacking that part. So that is the way this system is functioning. Even for the when you come to the cosmetic surgeries, actually for hiding the this wrinkles and all, you are stretching the skin actually by either putting uh, this margin, the unseen areas, we are removing the putting a incision and removing a part of the skin and stretching it. And finally, when you are removing, you are doing the removing some part of this body part also. So you are reducing your own cell, even the stem cells also getting reduced. You are introducing a scar, but the scar is not seen. That is the efficiency of the cosmetic surgery. But it can go wrong also. Actually, none of the cosmetic surgery, none of the cosmetics, none of this procedures is anti-aging. It is only masking aging. The real anti-aging is you promote your body, you promote your immune system, and to get rid of all the ailments. Like say, aging, first sign of aging is one of this reducing your flexibility. Then your bone is when your flexibility is gone, your bone is your physical strength of the bone is gone, start osteoporosis comes, yes, the sarcopenia, the muscles get weakened. So these all part is coming as a aging process. It is not the skin. It is not skin depth actually. It is the whole body is going through the process. And when you are adding medicines, you are taking more carbohydrate and you are taking tablets for the diabetes to control diabetes. So when you are taking tablets, you are damaging the liver, you are damaging the kidney, and because you are adding workload, the glucose itself, excess carbohydrate itself is adding your workload on the liver and the kidney excess glucose kidney has to excrete. That is one of the sign of or how you diagnose diabetes also. That is either by the blood glucose is increasing or the urine glucose is increasing. So again, when you are adding medication also, you are adding the stress of the body. Instead of actually, we are going in the wrong way actually. We are trying to control it with the medication. Actually, you should control your food. It is the most accepted method of anti-aging or the reverse aging also is reduce your calorie. If you are overweight, reduce your calorie, and your accelerated aging will come down to you can reverse. Simply, you can reverse the accelerated aging, not the gray hair to black. That is easy ways to do the dyeing. But you can reverse the body aging. You can find out nowadays there are many methods to find out the what is the real, the calendar age from the birth onwards, but what is the age of your body. Even if your liver function is getting deviated, that means your liver is getting old. Even your kidney function, your uric acid or creatinine or increasing, that means, or GFR is increasing. That means your kidney is faster aging of the. You can know the body age by the whole body and also organ wise. You know that there is methods to find out that. So if you correct your lifestyle, this accelerated aging and the lifestyle diseases grows together, and if you can correct it, you can reverse it also.
When we talk about aging, normally it is felt that the stress of life, modern life, basically the environmental stress, the work stress, and all that, it makes you age faster and it apparently feels like that. At the same time, you have been saying that actually the food that you eat and what you consume and what you use on your body for body care products and all that, they also usually create a lot of stress. Can you explain in what way this happens?
See, mental stress means there is some chemical mechanisms which is making stress on your nervous system. You feel emotions and mental activities and all is related to brain. So brain also, this everything is under chemical control, that is hormones and many this neurotransmitters and all is there. So if there is a change in the neurotransmitter or there is some down up, there are some neurotransmitters which is elevating your mood, or some neurotransmitters which is balancing and reducing. So it's all going in a balance actually. So these all are made of nutrition only. There are so many neurotransmitters working, and it's not only inside the brain, all over the nerve system. Even you have an enteric nervous system. It's a separate enteric nervous system, but it is connected to the. So what you eat and what is very important actually. I'm doing lifestyle modulation for lifestyle diseases. So psychiatric disease also comes under lifestyle disease. Diabetes also comes under this lifestyle disease. What 90% of the diseases which we are seeing, maybe more than that, is comes under lifestyle disease only. Exception is for injuries and infections, and even the injury and infections is the impact will be more for those who are on having a lifestyle disease. We know with the COVID, what happened actually, only those who are having diabetes, hypertension, heart disease, etc. are having was the one who was dying, or serious infection or serious complications are happening only to them, not for the healthy. Actually, healthy people are recovering very fast and without much problem. So maintaining your health is the most important thing, and get out of the this lifestyle diseases. You can reverse that, because with my experience I have seen that it is very easy to reverse lifestyle diseases like diabetes. Actually, when we are starting our lifestyle modulation or clinically supported lifestyle correction, we check the what is the status of the pancreas, whether the pancreas is producing enough insulin. If the pancreas is producing enough insulin, that means it's type 2 diabetes. If the person is taking injection, we cannot diagnose whether we cannot say that whether pancreas is producing enough insulin. Then we have to make another test called C-peptide level. So it is a byproduct of the insulin actually. So if the C-peptide level is normal, or if the non-insulin taking patients, if the insulin level is normal, that means it's a type 2 diabetes. Even if the patient is taking 4 times, 3 times, 4 times insulin and 3-4 insulin tablets also, we can confidently stop the diabetic medication and see, we can after stopping and start with the low calorie, low carbohydrate diet, we can see after 2 hours itself it is coming down. If the patient is following the instructions correctly, we see that within 24 to 48 hours, if it is a type 2 diabetes, we can bring down the blood sugar to normal level. That depends on the patients. Some cannot, craving for the carbohydrate will be more. Even those who are within a week, they will all settle with the cravings also, because we are stopping the diabetic medicines. Actually, this craving is created by this insulin injections and the medications which also is acting by increasing the insulin level. So insulin itself will create craving, and also insulin create immediately after the injection, the glucose level will go down. That will create a craving for the carbohydrate. So actually the diabetic patients and all is actually struggling or stressed up with this up and downs of insulin and glucose levels. Once the medication is gone, it will be easy for to manage. The same thing happens with the hypertension also. Not as fast. We don't stop the hypertension medicines just like that. After within 1 or 2 days, it depends on how many hypertensive medicines are there. Within 1 or 2 days, the BP start coming down, and one by one we do reduce the dose. And if the patient is cooperative, within a month, almost all the medications used for this lifestyle diseases like hypertension, fatty liver, uric acid, diabetes, and all, actually most of the medicines, and cholesterol, all these things can be reduced within reduced and stopped within 30 days. That is what actually we are aiming. Only things which is to be continued for certain period and all is those who are put on a stent, they have to be taking this blood thinners for a year completion. That is, if you are put in January, the stent is put, next 23 January, 24 January, then you have to take at least 25 January, you have to continue the blood thinners. That is not to protect you, and it is to protect you from the side effects of the stent, not for anything else. So if you have put some foreign things and all inside, so certain measures we have to take to protect you because for the side effects. Like if you have put a pacemaker inside your heart, some leads are going into your heart. So you have to take a lifelong blood thinners, you have to take lifelong. So such measures we have to take. Otherwise, simple things like diabetes, type 2 diabetes, hypertension and all, even those who have in renal failure stage 4 or even reaching 5 also, we are able to withdraw the taper of the hypertension medicines, and the patient can go to a normal BP. Even those who are patients taking 3-4 hypertensive medicines, usually they will not be controlled with these hypertensive medicines. And also the sugar, we know that those who are on insulin and many diabetic medicines, they will not be having a diabetic control. Most of them will be having with the medicines, the HbA1c may be 9 or 10 or like that. But it can be reversed. And also the body age also. These type of patients, this having diabetes, hypertension and all, will be having accelerated aging also. They may be 45, but their body age will be 60 or 65. Or 50, body age will be 55 or 60 or 75. So that depends on each person and how much fat they have accumulated, how much visceral fat is there. The accelerated aging will be, that can be reversed, and not only to reverse to normal, actually you can bring down your body age below what is the actual. For example, a person who is 60 years, their accelerated aging, he is having 68, but with the clinically supported lifestyle correction, we are actually checking this body age also, and they can come down to not only to 60, come down to even 55 or 50. That is according to the aspiration of the person also. So if they are more interested to do the exercise and continue with the pursuit to improve their health, they can improve a lot actually.
Nowadays, what we commonly see is the number of medications that patients take together for multiple conditions increases substantially over time. And we also hear that these multiple medications contributes to excessive aging, especially of the mental faculty also, and additionally it also increases mortality possibilities due to inherent complications of medicines acting sometimes against each other also. So, in this situation, when medicines are seemingly increasing day by day in terms of numbers and types and quantities and all, what is the option for a patient?
See, this modern medicines actually after 1950s is till after that these medicines are coming, and we are actually neglecting that the food and exercise and all. So medicine is there. So if any problem is there, a surgical correction. That was actually the norm when I started my medical education and all. In 1980s actually, 81 I started. That time we have so much hope in medicine and surgery. And I think next 3, 4, to 20 years, that was actually peaking. In after that, then we started understanding. At that time, I think only 1 or 2 medicines for the diabetes, 1 or 2 medicines for few medicines only for the hypertension and all. But see, diabetic patient is the complications of diabetes is that days and nowadays is the same. Those days also there are amputations and all is needed. Now also amputations. We are taking all the medicines, but this amputation and all the complications are coming. No, actually, we are adding the medicines, but we are not able to reverse the disease because this is not because of the lack of medicines we are getting the disease, because of the our lifestyle or our genetics. Definitely there is a play of the genetics. But if the parents are diabetic, the chance of getting diabetes for the children is high. But even for my experience, actually, I am giving the patients are coming from multiple. Or no, I have not seen 1 or 2 patients may be having only single disease, but many will be having multiple disease. Maybe the diagnosis, it's the problems itself may need a list will be long, 10 or 15 or whatever. So a diabetic patient may be having hypertension, obesity, and their kidney already having a nephropathy, neuropathy. Sensation will be affected, and the eyes can be affected, and their brain and memory has been affected. Already there is Parkinson's already sitting. So even skin diseases will be, even from the diabetes or hypertension itself, all this will be there. The patients will be taking so many medicine. I have seen people taking 30 tablets and all, and 2 times or 3 times injection. And so many medicines, because they are all system, all the specialists. The person may not be seeing one doctor alone. They may be seeing cardiologist medicine will be there, nephrologist medicines will be there. If there is a joint problem, there is adding again arthritis medicine, painkillers, and so many medicines will be there. So everything is going into your system, and first it will reach the intestine and it is get absorbed and comes to the liver. Almost all these patients having lifestyle diseases will be having a fatty liver, grade 1 or grade 2, or already it has started hepatitis and cirrhosis level, it may be reached. So those patients also is taking all this medicine. It is actually each medicine is training your system. Your first it is your liver. The poor liver will try to. It is its job to do the destroy these toxins. The medicines, whatever you are taking, the liver considers a toxin, and only those escape the liver, and liver is not able to handle it, only reaches the general systemic circulation, and reach your cell. Even a painkiller which is giving the paracetamol, if you are taking, maybe 80% or whatever percentage, I don't know, for each medicine it will be different. That much be destroyed, and 20% is it is going to this other cells and it gives the pain relief. So it is applicable for all the medicines, and even that medicine also has to be finally removed from the system, detoxified by the liver, if not possible by the kidney, and if not possible by the kidney, it will come to the skin and it has to be gone out as a sweat. Even some will go to the lungs also. Lung also will try to expel, that alcohol that is considered as a toxin, and lung try to remove the alcohol. That is why the smell comes. So there are a whole lot of system for our body to remove the toxin. Actually, when you are taking each medicine, you are stressing each organ, not only each cell. Actually, it is not if you have a pain in the head, it is the medicine is not reaching the head alone. It is whole cells in the body it is reaching. So it is adding stress for our body. And when there are other lifestyle factors is there. That's why you are first time primarily you are sick because of your bad lifestyle. There may be nutritional deficiency, toxins, excess nutrient like carbohydrate, or even anything, even sodium. Sodium is excess. When it comes, it will give you hypertension. And the first lifestyle correction we are asking for a hypertensive patient is reduce the sodium. And we know that even the sodium level is high, you can get a mental breakdown also. That's why when you go to sea, even if there is no water, you should not drink the sea water. You get mad. So now the studies also shows that sodium intake is so high with this processed food, because when the processing, the potassium is removed and the sodium is added. So ideally the sodium potassium balance to be is to 1:3 or 1:4. But what happens in the newer regime of food, it is actually sometimes it is reversed. So you need only 500 milligram of sodium or maximum of 1500 in the hot weather. But your sodium level may be going up to 10,000 and you need potassium around 3500 to 4500, but your potassium level is going down and maybe only to 2000 or 2500. So the ratio is reversing. That is the problem with almost all this. The children is showing all the this irritability and this agitation and all because of this change in our food pattern. Sodium potassium balance, and the most important is sodium potassium balance and also the omega-3/6 balance. Omega-3, it is the cooling or the stabilizing or the healing power, or the healing control of the healing mechanism is very low, and the agitation or the anti-inflammation level. Actually, this omega-6 is the anti-inflammatory defense in the generally immune system, but in the brain it is actually acting as the agitator. So if when the omega-6 is high, your BP will be management will be difficult, and also your stress management. And even the reason for the stress also is not the job. Actually, the stress level, the human is the most comfortable now in this era, the most comfortable, but we are more stressed because the lack of exercise. Actually, that relaxation comes from the many of the hormone interplay also. When you are doing exercise or physical activity, the bone and the muscles and all giving out some chemicals which is relaxing your brain and it is acting on the brain. Now we don't have physical activity and you are eating more of this imbalance, nutritional imbalance is there. That is the reason for that. It is not the work stress or anything. It is actually the stress induced by your eating habits mainly.
Actually, with this we come to the end of this discussion. on anti-aging and staying young. Thank you.